strength, honor, discipline. You're listening to the 911 Buddy Check Project podcast. Here's your host, Daniel Mills. Time to wage war.
Hey, what's up, everybody? This is Daniel from the 911 Buddy Check Project. I hope that y'all had a phenomenal weekend, and I hope that your Monday has started off even better. So for your Monday motivation, Monday inspiration, whatever you want to call it, I was talking to a client yesterday during a coaching call, and we just got to talking about imbalances and root causes of the imbalances that we experience mentally, physically, spiritually, and emotionally in the four mountains that we talk about here at the 911 Buddy Check Project. And an example that I've often used was talking about heart blockage and having a STEMI, or an ST elevation MI. And we got to talking about medication. So, you know, when you have blockage in the artery, blood flow can't get to the heart wall, and it causes pain, necrosis, like tissue death, all that stuff. So we started breaking down, you know, the psych meds, SSRIs, all that may be good for, you know, immediate relief of symptoms, kind of like we give morphine, oxygen, nitro, aspirin for STEMI patients, chest pain, all that, to alleviate pain, kind of dilate blood vessels, open it up, let some oxygenated blood get back to the affected areas. That's kind of how psych meds work for a little while. And I started talking about with my client, we have to address the blockage, right? So with a heart attack, we're not just going to address the pain, the symptoms, right? We're not just going to say, hey, here's you some morphine, here's you some nitro, here's you some aspirin, breathe in a little bit of this oxygen, and good luck, right? And a lot of times when we just go the medication route, which is very popular, and a lot of people know my position on, you know, just treating said issues with medications, all right, because it's not addressing the root cause. So if you look at how we treat a STEMI, we, you know, hit you with Mona, morphine, oxygen, nitro, aspirin, then we get you to the hospital, and we hang, you know, some heparin to thin out the blood, and in preparation to get you to the cath lab, all right? Because we know ultimately we have to open the blockage. We have to get, you know, oxygenated blood back flowing through the arteries to the, you know, wall of the heart, right? Because if we don't, we're going to have necrosis, tissue death. The patient's going to go into heart failure and or die. So we have to address the blockage, right? Once we address the blockage, you know, you're saved, right? And how that works? Maybe. So in my conversations yesterday, we expanded upon, well, yeah, once we address the blockage, we have to address the root cause issues, because we know that with STEMIs, they have high reocclusion rates. Especially for like your LAD or left anterior descending artery type blockages. They have high reocclusion rates. And oftentimes, and I've seen throughout my 18-year career in medicine, a lot of patients, I would see them weeks later after I got them to the hospital, got them to the cath lab and all that, and they would either reocclude and die or have another heart attack. And we see this all the time with our patients, because they don't address the root cause lifestyle issues. So we can address the symptoms with medications. We can alleviate some pain, same as we do with psych meds and depression meds and all that. We can get you to the, you know, higher level of care. We can address the blockage, which is the immediate life threat, which is a lot of times what we do with, you know, counseling and psychiatry and all that. and, EMDR therapy, cognitive behavioral therapy, all the, the different techniques that we have. But nothing is going to change. Nothing is going to improve if we don't address the root cause issue. All right. So once you get out of the cath lab, once you get out of the, the psychiatric offices, the counseling offices, you have to address the root cause. And the root cause of a lot of mental health issues, whether it be burnout, whether it be depression, whether it be anxiety, all of the above, go back to the lifestyle factors of being a first responder. We have to address sleep deprivation. Probably above all else, we have to address our sleeping habits, because you are 900 times more likely to have suicidal ideations when you're sleep deprived. After 16 to 18 hours, you're technically in a state of psychosis. You become drunk, same as being legally drunk. Yet we accept sleep deprivation and wear it like some twisted badge of honor. So we have to address sleep habits and sleep deprivation. We have to address, stress and mitigating, and like a risk mitigation part of stress, because everybody in this job is overstressed mentally, physically, spiritually, and emotionally. And there are techniques and classes and different, avenues that we can take, and we'll discuss at a later point, to mitigate the effects of stress mentally, physically, spiritually, and emotionally. All right. You have to, do a root cause analysis and address the health and wellness portion of diet and nutrition, of physical exercise, taking care of our bodies, opening up. That's why you're seeing such a movement with yoga for first responders right now, because it's literally creating change in the physical and mental portion of the four mountains. But we have to address all these root causes. So a lot of dis-ease comes from imbalances in the physical mountain. You're not working out. And I get it. There's days when you're, sleep deprived. You just don't feel like working out. You don't feel like eating right, but you have to. Your life depends on it. And it's no different than, we don't let people drink on the job, but yet we'll let them bang 2 or 3, Big Macs, and bang 2 or 3 large pizzas, and, down in Cokes and energy drinks and all this stuff that we know leads to increased rates of cardiovascular disease, increased rates of diabetes, pre-diabetics. We know all the things that come with poor lifestyle habits, but we have to address the root cause, because this is no different than us coaching and counseling a patient who just came out of the cath lab and is dealing with cardiovascular disease. It's no different than we coach patients who are dealing with diabetes or high blood pressure. Right? It's the same thing, but we have to address the root cause of all these issues that cause imbalances, tension, or dis-ease mentally, physically, spiritually, and emotionally. If we start addressing the mental and emotional portions and doing damage control and mitigating a lot of the damage that we inflict on each other and ourselves, if we manage the physical mountains, all right, and hit our nutrition, our physical movement, establishing PT programs, whatever, bringing in nutritionists, nutrition coaches, nutrition counselors, instructing people, and teaching people how to eat better, how to better move their bodies. We have, spiritual coaching, all right, have numerous resources for spiritual health, pastoral care, freaking spiritual coaches, of all backgrounds and religious beliefs to better facilitate and take care of our people. And when we start addressing these root causes, all right, to change the fruit, and the fruit is mental, physical, spiritual, and emotional health, we have to change the roots. We have to change what we're, fertilizing the soil with, and the soil content and the pH, acid-base balance of our soul. We have to start addressing this stuff and addressing the root cause of imbalances in not only in our lives, but in our coworkers, our brothers, and our sisters' lives. We have to address burnout. We have to address the mental health issues. We have to address the physical health issues. We have to address the emotional and spiritual health issues. Because like 4 tires on a car, if one of them gets off balance, it throws the entire car off balance. And to truly be our brothers and sisters keepers, we have to mitigate the mental, physical, emotional, and spiritual risk that we are all exposed to on a daily basis. All right, I've been through it. My friend Tony's been through it. Other people on our team have all been through the effects of being a first responder, of being a veteran. All right, and we have to address this stuff. It's no different than we address substance abuse. We have to, do a root cause analysis and start identifying, prioritizing, and executing on each level of the 4 mountains. All right, my friends, y'all have a great week. Keep doing what you're doing. Keep waging war on change mentally, physically, spiritually, and emotionally. We get one life to live, like that cheesy freaking soap opera back in the day. We get one life. Like Eminem said, we get one shot, one chance, one opportunity. Make sure you're hydrating. Make sure you're moving your body. Get some sunlight today. Drink some good water. Eat a good meal. Get your PT on. Start grinding out each day on change. We have one chance at this to be freaking legendary. Check out 911buddycheck.org. Check out The Motivated Medic. Check out his podcast. Check us out on YouTube. Hit like, hit subscribe. Go buy a 911 Buddy Check t-shirt. We have a t-shirt coming out in the next few weeks with us, the 911 Buddy Check Project, and my man, Tony, the Motivated Medic Falzone. We're partnering up. It's going to be a dope t-shirt. Proceeds will benefit the 911 Buddy Check Project and the Motivated Medic mission. It's going to be an awesome one. And it might just have wage war on it. Super excited. Got our subscription service coming out and a whole bunch of other stuff. So y'all know what to do. You have your orders for the day. Get out and execute now. See ya.